Hi, I'm Dr. Troy Baker. I'm a Permanente allergist at Northern Virginia. I am glad to join all of you on Facebook Live today. And today we are joined by three of my incredible colleagues who I'm proud to work with. And I'd like to introduce them now. We have Dr. Jamie Goldberg, who is a dermatologist, Dr. Allison Parker-Fahey, who works in family medicine, and Dr. Erin Yee, who is a pediatrician as well. So if you can join us and introduce yourselves, starting with Dr. Goldberg, that'd be great.
Hi, everyone. Thank you, Dr. Baker. So happy to be here. My name is Jamie Goldberg. I am a board-certified dermatologist with Permanente Medicine, and I work up in Baltimore.
Okay, hi, my name is Dr. Erin Yee, and I am a board-certified pediatrician with Permanente Medicine, and I'm practicing in Northern Virginia, and it's great to be here.
Welcome, Dr. Yee. Dr. Parker-Fahey, are you with us on audio yet or not quite yet? Okay, so when you're on, let me know, and then we'll have you introduce yourself. So thank you everyone on Facebook Live today. We're really excited to talk to you about the subject of hives, and we really welcome your comments, your questions. So if any of you, as you're watching, have something that you're particularly interested in, please go ahead and put a comment into the chat box, and we will honestly try to get to that before our time's up. So today we're going to be discussing several aspects of hives. It's something we commonly see, and I hope it's helpful to all of you, as it is interesting for all of us to discuss. And so we're going to start with Dr. Goldberg for the first question. And Dr. Goldberg, if you can walk us through, what does a hive look like? What are the symptoms that are associated with hives? If you would like to start, that'd be great.
Sure. I think we may have a picture to go along with this. If maybe we can pull up that photo that was on the intro slide so we can get a look at a classic picture of hives. So as you can see here, hives are raised areas of itchy skin, and they can range anywhere in color from skin color to pink to actually quite red or bright red. Sometimes the color will depend on your background skin tone. So you can see here on fairer skin or lighter skin, you can see a lot of redness or at least pinkness in this picture. If you have a darker background skin tone, it may be a little bit harder to appreciate the redness. And here you'll want to look for that raised, puffy, or what we call welt-like skin. I think we have another photo to show you as well, if we can pull up one more. So here you can see the redness is not quite as prominent. It tends to be more skin colored, but you can still appreciate that raised or puffy or welt-like area of skin. Another characteristic of hives is they are itchy. These tend to be incredibly itchy. They will keep you up from sleep if you have them at night, so they can be quite uncomfortable. They oftentimes come in crops like this, where you have a group or cluster together, though they can really appear anywhere on the body. Anywhere where you have skin, you can get a hive. And I'll say one of the last distinguishing features about hives that's important to note is that they're transient. So they don't last long, sometimes as short as minutes, typically hours, and usually each individual hive does not last longer than 24 hours. So you may have crops that are coming and going, but if you drew a circle around one of these individual hives, it typically goes away on its own without leaving behind any other skin changes, and it usually does that within 24 hours.
Oh, that's awesome. Well said. I love the pictures you brought in. That's really great. Something we see all the time. So I'm going to take the next question, then I'll pass the time over to Dr. Yee for the next one after this. So when people get hives, what is the expectation on how long they should last, and what's a course look like? Well, we categorize hives in two ways. We call them acute hives and we call them chronic hives. Most of the time, 20% of people at some point in their life will get a form of hives, and usually acute hives is what they'll have, which means you're going to get this kind of rash that Dr. Goldberg described that's going to last anywhere from 1 to 6 weeks. So it's really concerning to people because this rash keeps popping up every other day or every day at times for a few weeks, and you wonder, is it ever going to go away? But the expectation is, if you ever get this rash, it might be with you for up to 1 to 6 weeks in most cases. If they go beyond 6 weeks, then it's in another category called chronic hives, which we'll get there a little bit later. I see Dr. Parker Fahey's on now. Or if you don't mind, Dr. Parker Fahey, introducing yourself, and then I'll give you a question after that. And so go ahead.
That sounds perfect. I really apologize. I'm Dr. Allison Parker Fahey. I'm a family medicine physician seeing both adults and kids in our DC and suburban Maryland areas.
Well, welcome. So the question I would pose to you is, you see hives on a regular basis. When you see a hive, like what goes through your mind of possible causes that you help explore with the patient?
Right. So in primary care, we see this a lot. And typically what I try to ask is if there's other symptoms involved as well. A lot of times that might be the only thing that presents. And so a lot of times it has to do more with exposures, any kind of recent new foods, medications, exposures outside, different times of the year, their history, whether they've had it again. But I also tried to ask questions as far as systemic effects, any fevers associated with it, nausea, vomiting, joint pains, because when they're coming to me, a lot of times it's because of other things involved as well, versus just truly the hives.
Ah, thank you. Yeah, well said. Yeah, hives can often be associated with other symptoms as well. So I'm glad you brought that up. And Dr. Yee, we're coming out of the viral season. You're our pediatrician. How do you see viruses playing a role in hives in your practice?
Yes. So in pediatrics, we see during the sick season and the fall and the winter with the most commonly presented cause of hives are viral infections. So the common cough and cold. Usually kids come in with a constellation of symptoms: the runny nose, the congestion, the cough, and then either have hives or have hives develop a few days later. And usually, again, because hives are associated with viruses, they can last, again, anywhere between 1 and 6 weeks of having that viral infection. Some of the most common viruses that can be associated with hives are RSV, or the respiratory syncytial virus, that was wreaking havoc this past year on our kids, but also coronaviruses, including COVID-19 virus. And we also see a lot of hives associated with other infections like bacterial and parasitic infections, but they're just a lot less common than the common cold viruses. So we just see a lot less of that, but definitely with the viral infections.
Thank you. And Dr. Parker Fahey, with adults, do you often see viruses as a common cause in your patients that get infections in your population?
Absolutely. Yes. So viruses do play a big, huge part, especially around winter seasons, of causing hives. A lot of times there are a little bit of both going on. Hives that are associated with other things, but we do see a lot during the winter times with cold and flu season, and RSV, as we know, we even saw in a lot of adults, not just children, these last couple of years.
Yeah, I'm seeing the same thing. Often I see hives as well that I feel like some kind of infection was the main trigger. So we're going to move away from that for just a minute. But one thing that people sometimes wonder, like they'll use the word hives to describe lots of different kinds of rashes. Dr. Goldberg, I'm going to defer to you on this one, but when you see someone with bug bites or other rashes or hives, what helps you guide, this is hives, this is not bug bites and stuff. Can you comment on that for a minute, please?
Yeah, that's a good question, because as we know, bug bites can look a lot like hives. They can be raised, red, and itchy bumps that happen on the skin. Sometimes you can get multiple or a crop if you got several bites. So it can be a little bit hard at first glance to differentiate between them, but there are a couple of clues that can be helpful. What I touched on earlier about that transient nature of hives is really helpful. So like I said, if you have a raised itchy bump on your skin and you drew a circle around it, oftentimes that goes away within hours or within 24 hours. Many other types of rash, eczema, and bug bites, they last longer. So it's going to be several days. Sometimes they're excoriated or scratched because they're so itchy and they've been sticking around for a while. And oftentimes as they heal up, they'll leave some discoloration behind where the bug bite goes away, but you can see a little dark mark or a pink spot where it was, so for sometimes even weeks afterwards. And that's different from hives, which tend to, once they clear up, you really don't see a whole lot left behind. So those are some clues that you can use.
Yeah, I totally agree. Often, the hive moves regularly where the bug bite stays put. So I love how you made that differentiation. And so as we're coming out of the sixth season, a lot of times, like I'm going to turn to Dr. Yee on this one, you're treating people who get infections, ear infections or whatnot with antibiotics. How do you counsel your patients when they're on an antibiotic and they develop hives? Like walk us through that. What are your thoughts?
Of course. So this is very, very common. During the sixth season, when we have a lot of viral infections, kids come in with prolonged or multiple days of fever, and we diagnose a secondary or a bacterial infection on top of the viral infection. So for example, classically, ear infection. When we subsequently place them on an antibiotic, such as amoxicillin, very common in pediatrics, we see that a few days after they start the antibiotic, they develop hives. Because again, hives can be associated with viral infections, bacterial infections, or you can have an allergy to the amoxicillin or the antibiotic that can result in hives. We can say what we don't know for sure, which is causing the rash. So at that point, I have a discussion with the family that for now, we need to list the antibiotic as an allergen or an allergy, put it on their allergy list in their medical record so that they don't get this antibiotic for now. And then in the future, when they're school aged, we can go ahead and circle back with an allergist, such as yourself, Dr. Baker, to actually do very great allergy testing for the medication. And I try to reassure parents that most of the time, the hives is most likely due to the viral infection or bacterial infection, as opposed to a true allergy to the antibiotic.
That's well said. And I love when I see your patients, I feel like you set them up so well for what they're, the allergy testing for penicillin. So I'll just comment a couple of things extra on that too, from my perspective. So, Dr. Yee, you're totally right. We don't really know if it's the virus or the drug causing it, or a combination of the two. But often, penicillin allergy is the most common antibiotic allergy. And in fact, in studies, we find that 95% of people outgrow a penicillin allergy. So if you or your child has a penicillin allergy, there's a high likelihood that's going to go away. And so often, around school age kids, we'll offer two options. We'll do a skin test, or we'll do a small dose of the drug in our clinic, then a bigger dose of the drug in our clinic, just to help get that off their records, to give more options for doctors when they see you in the future, that they can treat you with a penicillin antibiotic if that's appropriate. So I'm glad that you brought that up. Thank you. So next question for Dr. Parker Fahey. Often people want to know, are my hives a reflection of some underlying problem that I need to address? And when should I come in to see my physician if I have hives? Like, how would you answer that?
Right. These are great questions. So hives, can be frustrating for patients and for physicians because generally we're not able to pinpoint exact causes to hives. And, especially if these hives have only been going on for less than 6 weeks, lab work's not indicated. It really won't give us a lot more information. With typical kind of antihistamines, over-the-counter antihistamines, it can go away on its own. So when do you make an appointment? I think the best thing to do is one, timeline. If it's more than 6 weeks and, over-the-counter antihistamines are not helping and you can't pin down a cause, in addition to other symptoms. So you might want to see your physician earlier if you're having shortness of breath with your hives, if you're having joint pain, fever, and those systemic symptoms could say that something else is going on, that this is not just hives. So I tell patients definitely come to see me if you're having other symptoms. And then also sometimes, like you said, I think 1% can be chronic hives, and that can be really frustrating for patients, especially when there's not a known cause. And so I encourage patients to come and see me when they're just really frustrated and overwhelmed with that kind of chronic diagnosis, because, together we can sometimes make it a little bit more livable for those that do have those chronic hives. And then lastly, if you're just not sure, go and see a doctor. It's always better to kind of have more information and be prepared with kind of the next steps to help with anything. So.
Oh, well said. I love your comments and agree. Like often with we are forming a partnership with our patient. It's a frustrating disorder in that we often can't give you the reason for the rash, but we definitely have lots of steps and tools to make you comfortable while the rash is there. Now, you did bring up that about 1% of people will have chronic urticaria or hives that last a long time. And there's an interesting subset of people who get hives that we call physical urticarias. And Dr. Goldberg, would you mind touching on some of those? Like what is a physical urticaria and what types are there?
Yeah, so I think we talked about some of the main causes of urticaria or hives, like viral illnesses and certain medications, foods, but there's also a big category which usually cause these chronic urticarias that last longer than 6 weeks that we refer to as physical urticarias. And these are when there's some sort of environmental or external stimuli that's inducing the hive-like rash. So examples of this are heat or cold, exercise-induced urticaria, sweat. Sometimes these external triggers can cause these hive-like eruptions, and it can be very frustrating because some of these things are hard to avoid. Another classic physical urticaria that a lot of us have had experience with is something we call dermatographism. So literally where you can write on your skin. I think we actually have a photo of this. So if you take your fingernail and scratch down your skin, or sometimes in clinic we'll use the edge of a wooden tongue depressor to scratch the skin. And it's more than just a little mark you'll see left behind from a scratch, but you actually see within minutes the skin start to puff up. You get that raised red marking on the skin. And so that's what we call dermatographism, another type of urticaria or hive that's induced by something on the outside. These can be, again, frustrating because it's not always easy to avoid them, but I think we'll talk about some tips for treatment even of these types of hives as well.
Great. Yeah. In the wintertime, I see a lot of people with cold induced urticaria. And so they come in from outside and they have hives all over their face. That is a common one I see. And then in the summertime, the heat induced urticaria is very common in my practice. And so thanks for touching on those. Here's a question that I get often, or I see people for. You go get a vaccine and then you break out in hives. And people want to know, am I allergic to the vaccine? Can I get another dose of that vaccine or not? And so this is very common with us. And so here's what I would share with you. So if you get a vaccine and your hives occur hours later, and outside of 4 hours is kind of the where we mark off it's more concerning to us. So if you get a vaccine, 4 hours later you have no rash, we find that very reassuring. Now after 4 hours, you might develop hives, and those hives may last just a few days to a few weeks. This does not mean that you're allergic to the vaccine. So if you get hives 4 hours after a vaccine, you are not allergic to it. Your immune system likely is mounting a response to the vaccine, but on the side effect is your immune system is also causing hives that may last a few weeks or even a few months sometimes, but you are not allergic to the vaccine and you can get it. Now, if there's any question about that, you should ask your physician. It's worth talking to them about, but it is a common thing that we do see with vaccines at times. So the other question that I get is often is, do seasonal allergies cause hives? Now, seasonal allergies do not necessarily cause hives, but they make you more susceptible to getting hives because your histamine is a little bit higher with the seasonal allergies, and that does make you a little bit more prone to getting hives. Other things that can make hives more easily come out, if you're on medicines like ibuprofen or Motrin, that can sometimes make hives more easily to appear. Doing heavy exercise, if you're drinking alcohol, or if you're stressed at work, those kind of things make you more susceptible or more prone to getting hives. So I'm going to turn some time over to Dr. Yee. Your approach. Now, can you walk us through some of the type of medications that you may reach for to treat hives? Like, what's your starting approach with the treatment of hives?
Of course. So I know Dr. Allison Parker Fahey already touched base a little bit on this, but in primary care and pediatrics, we definitely like to treat hives after a diagnosis, a clinical diagnosis, with just some over-the-counter medications, oral antihistamines that are generally we use a lot in allergies. So for example, long-acting single oral medications such as Zyrtec, Allegra, and Claritin are really good options. They tend to last all day and they don't make you drowsy. But you can also use in the evening a little bit of Benadryl, which is an older generation of antihistamine that makes you a little bit sleepy because it helps basically kids when they're scratching so hard and trying to fall asleep, it makes them a little bit sleepy, so it can help them do that.
Great, thank you. Dr. Goldberg, do you have any other tips that you use when you're treating hives, like things that you go for or reach for?
Yeah, so I agree with the antihistamines, and I'll add sometimes we do need doses that are a bit higher than what's recommended on the label. So this is obviously something that you'd want to discuss with your doctor when you're seeing them. But sometimes medications like cetirizine or Zyrtec that are made for once a day, sometimes we need a little bit more than that to get the hives under control. In addition to the oral antihistamines, sometimes I will prescribe a topical corticosteroid, something like hydrocortisone or in that family, something that you can put on the outside of the skin that just kind of soothes the skin, takes away a little bit of the itching or redness. The last tip that I sometimes recommend is a cool compress or an ice pack. Sometimes that can break the itch cycle. Obviously, these are only in cases that aren't triggered by cold, but sometimes a cool compress can also be soothing.
Yeah, absolutely. Love those thoughts. And Dr. Allison Parker Fahey, anything else that you may or may not do differently that you want to add to this?
Sure. So the only thing I would just add is for Benadryl, when I do recommend it for patients either on either extremes, either kind of my younger patients or my older patients, sometimes there's a little bit of a paradoxical reaction where they actually wake up and they can't fall asleep. So just if that does happen to your children or older adults, then don't worry. That's actually sometimes common. So to make sure that if that happens, don't worry. There's not something wrong. But you can still use that as well.
Great. Well said. Yeah, I don't have anything really different to share other than like the points that have already been brought up. Like I often will have to use antihistamines 4 times the normal dose. So I go up pretty high. Now, sometimes even no matter how much medicine you put on, it doesn't seem to be helping too much. And in those cases, there are certain shot medications that we can do in the allergy clinic that will help. One of them is called Xolair that you may have heard of. And sometimes we use immunosuppressant drugs called tacrolimus that we will often use to treat hives too. So if you feel like nothing is working, that doesn't mean there's not a solution for you. I would just say, keep asking your provider, is there any other options? And there are other options. And so it's not a hopeless problem you just have to live with until it naturally goes away. Hives by 5 years, 95% of people or 90% of people out will lose hives. So it can last years even. So it is a long race that you're in sometimes with hives. And so you do need to partner up with a doctor that can help you find a treatment that's going to work well. Great thoughts. So other questions that I'm looking to see that has come up here. Okay, let's try this one. So we'll go back to Dr. Parker Fahey. Now, if people are on these high dose antihistamines? What are some of the side effects like you counsel your patients on that to watch for on some of these medicines? Anything that sticks out to you that you share?
Yeah, so a couple things. One, I do find people sometimes have dry mouth. Sometimes, especially for the stronger ones like Benadryl, increase hunger, and so sometimes weight gain, sleep disturbances. Even though it kind of puts you to sleep, it's short hours, and then they tend to wake up and not get good quality sleep. So for those sleep aids that have Benadryl in it, same kind of thing. For older patients as well, there are some for the type 1 antihistamines like Benadryl, some increased dementia if taken for a long period of time. So just to be careful, talk to your doctor when you're taking anything, either more than that's recommended on the bottle or for long periods of time. And so those are kind of the big things that I look for. And then also, as far as the 3 common over-the-counter antihistamines, some of them, for different people work better. And so if one's not working, well enough, you want to do Claritin, switching to Zyrtec. Oh, that seems to help a little bit more. Oh, Zyrtec makes me a little tired. You could switch to Allegra Claritin. So knowing, like you said, that there's always options, continue that communication and dialogue with your doctor, because if something's not working, there's something else to try.
Yeah, that I love how you said that. It was super helpful. Dr. Goldberg, I'm going to ask you the next question. So people ask me often, are hives contagious? Like, how can you walk us through that question? How would you answer that?
Right. So we know that hives are not contagious. Now, they may have been triggered by a viral illness or a bacterial illness or something else that was contagious, but the hives themselves, the skin rash of hives is not contagious. So you don't have to worry about touching the skin if you're treating your child with hives or your partner with hives. You don't have to worry about any risk of spread from a being contagious standpoint. You don't need to worry about that.
Yeah, well said. That's totally true. So this one I will leave up for anyone to answer, and I've heard actually answers from some of you already on this question, but some people want to know, is there natural ways that I can treat my hives that I don't have to take conventional medications? Like, any thoughts on this question? It's open to anyone. I have some thoughts that I can share, and I've heard some of you actually share thoughts already that I'll bring up if it's not mentioned again, but anyone who would like to start with that?
I can start with this one. One tip that I recommend for my patients is to keep a diary. To keep a diary of medications and foods and activities during the day if they're getting these bouts of hives. I know we mentioned we don't always figure out a cause, but sometimes if we're diligent about our note taking, we can figure out something that's triggering it. I think a good example or classic example that I had of just a patient last week was she had been taking NSAIDs or Advil just every once in a while. It wasn't a prescribed antibiotic. It was every once in a while for menstrual cramping here and there. And so it didn't really click to her that that was a medication that might be triggering it. And once we sort of logged down what she had been taking, what she had been eating, what she had been doing during the day and exercising and things like that, we were actually able to narrow it down to the Advil that she was taking periodically. So sometimes keeping a list, and then obviously if there is a trigger that you can find, eliminating that can help remove any cause for need for any medication at all. So doesn't always work like that, but when it does, it's always nice to be able to eliminate. For periodic headaches or cramping or pain, Tylenol has a little bit of a less risk than the class of medications we call NSAIDs. Very
true. Other thoughts? Thank you for sharing that, Dr. Goldberg. It's awesome. Other thoughts from either Dr. Parker Brady or Dr. Yee?
Yeah. So I think it was mentioned before, but kind of cool compresses, taking kind of lukewarm to cooler showers. Your kids are complaining, maybe a cooler bath. Sometimes they pop up at night because you have a lot of blankets, so not having as many blankets. I have had some patients who speak with nutritionists and try like kind of a low anti-inflammatory diet, which works for some and not others, but that's definitely an option. Some of our nutritionists have helped some of my patients with that, especially for more kind of chronic inflammatory issues. Those are kind of the 2 big things that have nothing to do with medicine. And then obviously the avoidance, if you can figure out what's kind of triggering, like Dr. Goldberg said.
And I'll jump
Great.
in there too, because
Yeah.
Dr. Parker Fahey, I hear that all the time. Patients say, oh, but the heat feels so good. I took this super, super hot shower, but it's so short-lived. So I always recommend to stay away from the heat because it might feel good right then and there in the moment. But we know that heat does tend to be another trigger of histamine release, ends up making it itchier in the long run. So if you can stomach a lukewarm or even cool shower or bath, that's always preferred.
Yes, the other point out, I will say, everyone said the same kind of message that I deliver one other thing is don't scratch, maybe push on it, but don't scratch it if you have to. Rubbing in Vaseline or thick creams like CeraVe, Vanicream, sometimes can just make your skin feel a little bit more moist and less itchy. These are all minimal things, but when you have hives, everything can help. So it's something I also will share with my patients.
In pediatrics, I also recommend, cool compress, but sometimes it's a little tough for a squirrely little toddler to hold a compress on him or her. So I say commonly we can, dampen the long sleeve pajamas and keep it nice and cool, and have them just have a loose pajamas over them. So it kind of keeps them cool, but also prevents them from scratching the skin. So it helps in 2 different ways.
Okay, I loved our discussion. I always enjoy hearing from all of you. I think it would be great if we just go around the room one last time and just take a moment to think about what your key message might be. It's something we likely have already said, but something that you like to share with your patients in terms of how you handle or treat hives. So we'll start with Dr. Goldberg, and then Dr. Parker Fahey, and then Dr. Yee, and then I'll conclude if that's fine with you.
Yeah, sure. So a tip that I often tell patients is if they develop hives to try to snap a photo, because there's nothing more frustrating than making a doctor's appointment that sometimes can be a couple days away or a couple weeks away, and when you show up, the rash is gone, which can be the case with hives. So if you're not having other symptoms like the fevers or chills, shortness of breath, diarrhea, if it's really just the skin rash, you certainly don't need to run to an emergency room or urgent care. Snap a photo, make an appointment with your doctor. If you have the ability to send a message or do a video visit with your doctor, then that's always a great opportunity to catch it in real time. But otherwise, photographs can be extremely helpful when you are seeing your doctor and when the rash frustratingly is not there.
That's a huge tip. I'm glad you brought that up. Not even discussed today, but huge. Thank you. Dr. Parker Fahey.
Yeah, so definitely agree with the picture, especially for timeline when things have been there for a long period of time, so we can kind of evaluate throughout your history what it's been looking like. And I think my big kind of take home point is if it's, if you've already seen a physician and you're still having issues and you just feel frustrated, follow back up, because like we said, there are always other options. There's always something else that we can talk about, or at least try to help relieve some of your symptoms.
Thank you. Well said.
And for me, in pediatrics, hives is most commonly associated with viral infections or the common colds. So don't, let us know if that happens. Again, take a photo and send it to us via online via secure message, or email us via our nursing staff, so we know. And then if a child's on an antibiotic for a bacterial infection and has hives, let us know as well.
Thank you. The one thing I would probably add that's people always, when they come to see me, they want to know if it's a food. And the one point that I'll just share, the small helpful pro tip would be, if it's a food allergy and you eat the food, it's generally going to have hives happen within 15 to 30 minutes, and often even faster than that. And also the hives don't go on for several days. So if you ate some shrimp and you have hives 5 days later that continually are going on, it is not going to be the shrimp that you ate. The shrimp allergy will just move, within 24 hours will be resolved, and that will be over. And it's usually pretty obvious to people. Food allergy is predictable, consistent, reliable, reproducible. Every time you eat the food, that reaction happens very quickly. And the other point that we've shared is we have lots of approaches to hives. Please share the pictures with us. Ask us a basic strategy to start immediately with your hives. We all have them, and we can help you soon. So thank you again to my panelists, Dr. Goldberg, Dr. Parker Fahey, Dr. Yee. I'm really grateful for your wisdom you shared today, and thank you for joining us on Facebook Live to discuss this great topic.
Thank you.
Thank you so much.
Thank you so much. Bye-bye.
Thank you, Dr. Baker.